The following presentation is a production of Ride the Wave Media.
It's the Best Birth Podcast, where we interview experts that elevate you as you prepare your heart and mind to have the best birth.
Each episode will interview professionals so you are prepared for pregnancy, birth, and postpartum. Our experts will build your confidence and empower you to trust your intuition throughout your pregnancy.
This audio is taken from videos on YouTube. Watch the entire episodes on YouTube at Birth Made Mindful. You're listening to the Best Birth Podcast. Today, our expert is Dr. Thayne Gardner, a pediatric dentist.
Dr. Thayne Gardner is a board-certified pediatric dentist. Dr. Gardner graduated from Brigham Young University and performed his dental training, 4 years of dental school and a 2-year hospital residency, in Buffalo, New York. He then worked for 2 years in Idaho before purchasing Little People's Dental in South Jordan, Utah, where he's been practicing for the last 9 years. Dr. Gardner recently won runner-up in Best of Salt Lake City in pediatric dentistry. When not doing dentistry, he can be found playing pickleball or hiking in the mountains with his wonderful wife and 5 children. Welcome, Dr. Gardner.
Thank you so much. Thanks for having me on the podcast.
We're so excited to have you on the show. And as a pediatric dentist, you get to see our littles when they come to you with problems after they're born. But we also know that there's huge reasons to take care of our own teeth during pregnancy. So let's start with the moms. Let's start with the people who are having those babies. Why is it important for us to focus on our dental care during pregnancy?
Absolutely. So the mouth is such an integral part of your whole oral health and body health, and your mouth is connected to the rest of your body. When you're pregnant, things change. You know, your cravings change, your body changes, everything just seems to be out of whack a little bit, and including your mouth. And so your mouth just reacts more than normal. So normally if you're doing the regular things like brushing, flossing, and you have like a little bit of plaque, your gums are okay with it. If you do the same things, and when you get pregnant with the difference in hormones and everything else, your gums just react way more. So they can bleed more. They can get red and puffy and swollen and hurt. Your mouth might dry out. It might, if you have morning sickness, you're throwing up all the time, that acid is just like wearing away at your teeth. So you really need to be vigilant with your teeth as best you can. And I know it's tricky when you're pregnant. I have 5 kids. My wife's been through it, each time, and sometimes you're just trying to hang on for dear life, and you're like, man, that teeth is one more thing, but you're smiling with it every day, you're chewing with it every day. It's helping you stay healthy. So when I have talked to some of the moms coming into my office, I don't treat adults, I love kids, and we'll get to that in a minute, but there have been plenty of moms that have come in and said they never had a cavity their whole life until they got pregnant. And whether it was the cravings, whether it's the eating and snacking all day long because you're eating for 2, is it the acid from throwing up or the acid reflux? It's just everything's out of whack, or like I said, you're just trying to hold on for dear life, and you might skip the brushing of the teeth or something else like that, and so then it can catch up to you. So we're really trying to help moms be healthy before, during, and after, and so that they're not blindsided after, oh man, I got a bunch of cavities, or now I've got issues because of the changes.
So what's your advice when we are experiencing morning sickness and we are throwing up? Are we supposed to brush immediately after? Are we supposed to wait? I've heard to, kind of like take a sip of milk afterwards instead of brushing so that we don't ruin our plaque. Is that, or what are we ruining if we're brushing too often after throwing up?
Yeah, so let's step back just a touch. So cavities and wear on your teeth is from acid. It's not from sugar. So you eat sugar, the bacteria in your mouth eat it, make it into an acid, and the acid is what wears away the layers of your teeth. So the outer layer is enamel, and that's usually super strong. But once you get it in an acidic environment, it starts wearing away layer by layer. So when you're throwing up or have acid reflux and you have all that acid in your mouth, then it starts wearing away or putting holes in your teeth. And so what we recommend is you rinse out with water, or milk or whatever you can, something to neutralize it. So you're trying to get it back to an unacidic environment. So it would even be better if you had alkaline water or baking soda water. Like just take a teaspoon of baking soda and put in some water. Maybe have that in its own special like water bottle or something. So if you know that you're going to be throwing up, maybe have that ready so that you can at least rinse with that to try to neutralize it as fast as you can. We don't want you to brush right after because then your teeth are softer, they're more likely to wear away, and sometimes what happens is when you brush right after, you're wearing away that layer slowly but surely, and over time you're thinning out your teeth, you're making it more susceptible over time to issues.
And then the role of those cleanings. Don't skip them when pregnant, yes?
Correct. So the American Dental Association says you can do pretty much anything in dentistry while you're pregnant. Having said that, I would really recommend you really be preventative. So I want you to establish a dental home is what we call it, a relationship with a dentist, someone that you know and trust, and that you're going in routinely for, you're staying up to date on it, so that there's nothing you're not expected. Have a toothache or a dental infection in the middle of your pregnancy. You want to make sure you're taking care of things along the way and try to prevent as best you can. And so definitely go in, don't skip your cleanings. They'll be able to help guide you into how to take care of your teeth. Is there a spot that you're missing or you're struggling with, or it's a little extra sensitive and you're like worried about it and you're like babying that area, and they can help you with it or give you tips and tricks for how to do it. And then pregnancy is a long time. Normally we go in, to the dentist every 6 months. If you're like thinking you're going to get pregnant and then you get through the pregnancy and then your life's going crazy because you have a new baby, it could be like a year or more by the time you get back, and then things could happen in that time. So, the American Dental Association says you can do x-rays, you can do the cleaning checkups, you can do fillings and other stuff. If you had to have an extraction or other things, you can get numb. Having said that, most dentists want to try to minimize. And so definitely no cosmetic work or anything, all that elective stuff, it can wait. That's totally fine. I'm guessing most pregnant moms aren't like, oh, I'm going to get this, makeover smile right now. But it's more of staying on top of things. And if you need to do a little filling, that's okay, so that you don't need a root canal or an extraction or something in the middle of it. The first trimester, we try to be sensitive to that and make sure we're not introducing things to the body as like during that developmental phase when the babies are super sensitive. And the last trimester, you're big, you're uncomfortable, laying back in a dental chair is not the most comfortable thing. And so they might, if you had to go at that point, they might sit you up a little bit and help you be a little more comfortable or try to help you like work around it a little bit. So second trimester, you might be most comfortable going, and try to time that cleaning and checkup sometime in that time so that you can get middle of the pregnancy and then get through, have your baby, and then maybe a few months later, once life settles, hopefully you're getting some sleep. At that point, you can go again.
I love that point, to establish a home dentist. Then if problems do arise, you'll know where to turn. You won't be having to do the research while you're in the crisis. I love this talk of preventative care and just how we can better prepare to go to the dentist. So thank you for those tips.
When we're at home and we're brushing our teeth and we're flossing, is there a specific brand or type of toothpaste that could be used during pregnancy that's more beneficial?
I would just say the consistency is more important than brand. So I love electric toothbrushes. Like, it helps so that it's like buzzing along and cleaning stuff out and getting nooks and crannies that you might not be able to get to normally. And if you're being a little lazier with it, then it helps you with it. So anything that you're more comfortable with can help you out. Water picks are great to go get all the little chunks out there and really help with gum health. I've seen way healthier gums on kids and adults that have electric toothbrushes and water picks and stuff like that. So yeah, brushing, flossing, mouthwash, saltwater rinse, whatever you can to try to just increase the oral health along the way.
What about the tongue scraper?
So tongue scrapers are great. So you can even just use your toothbrush if you want and just brush your tongue, especially if it's getting fuzzy furry or getting stuff stuck on there, then definitely brush that back. Not so far back that you're guiding yourself, but yeah, cleaning it off, because the bacteria in your mouth that can cause cavities or lead to gum issues can hang out on your tongue. Some people's tongues have like lumps and bumps on it, or fuzzy furry, like I said, and some people's are super smooth. So it just depends, and I would brush, floss, yeah, get your tongue. Some toothbrushes have a little tongue scraper part on the back of it, and so it just depends on what you have. But you can go ahead and just get that clean, wipe it off so nothing's building up on there.
This is such great advice for us in pregnancy that we can take care of ourselves and hopefully prevent any major issues from happening. Can we jump into our pediatric?
I love it. That's my favorite. Let's do it.
One question before we specifically get to the newborn baby is prenatal vitamins during pregnancy.
Yes.
Do those greatly enhance the teeth of the baby, or what does the research show there? Are you aware?
Yeah, so we really want you to make sure that you're healthy and that you're eating a healthy diet, and the prenatal vitamins will help with that. So we want vitamin C, vitamin D, calcium, phosphates, like all that stuff helps with bone health, with teeth health, and the better you have that, then the teeth will develop better on your newborn baby. The baby teeth start forming in utero. So it's not that they're just forming, after birth and they suddenly show up. Your health will impact your baby's health. And so if you're sick along the way or you're malnourished along the way, then it can lead to developmental defects on the kid's teeth, whether it's like yellow spots, white spots, little divots in the teeth. So the better you can care for yourself, the better the baby's health. And sometimes that's manifested in the teeth as they come in.
What a great bridge. So then when we have baby, when is the first checkup and what can we have to look forward to?
Great. So I'd recommend that you come in either when the first tooth comes in or by their first birthday. By their first birthday, they have some teeth in there, and we really want to hit it head on. And I think of it more like a well-child visit at the pediatrician, where, yeah, I'm going to take a look in there, and I'm going to make sure there's no issues. But a lot of it's me talking to the moms. I want to establish that dental home. I want them to know that I've got their back, that they can call me. They can call my cell phone on a weekend or nights if they're like worried about something, or if baby falls and hurts a tooth or something, that we can rally around them and help them with whatever they need. But let's guide them to know what's coming in next, how to take care of it. What kind of habits do you have at home that we can talk about so that we can set you up for success down the road? So kids crave routines. They want to have the same thing over and over. So is it, okay, we're going to bathe the baby and then brush their teeth and then read a book and then go to bed. And if you're consistent, like every night, if you skip a step, because no, wait, you forgot to brush your teeth, or you forgot to read the book, or I can't go to sleep now until you do it, So if they see that you're taking care of your teeth, they'll want to model it, and it'll be okay. And then it's like getting them into that routine for life and guiding you to know what that could be.
And do we start the routine of brushing teeth when the first tooth appears? Is there any benefit to starting prior to that?
So yeah, the bacteria in your mouth are starting even before the teeth come in. So it'd be great to at least wipe their gums with a washcloth. You could get a little baby toothbrush and get them used to it and sort of rub their gums, especially when you see those bulges of the teeth starting to get closer. You could start getting them used to it. And then as soon as the teeth come in, I want you to start brushing those morning and night. And the recommendation from the pediatricians and the pediatric dentists is that you use fluoride toothpaste from the get-go. The baby teething toothpaste really doesn't have anything protective in it. It's just trying to get them used to it, I guess. But if we can avoid cavities, then we can keep them healthier and try to prevent it. So like a little 1 or 2 year old, they're not going to sit in the chair and let me fix a tooth that has a cavity in it, right? So we want to try to avoid it as long as we can, hopefully forever, but at least until they can sit in the chair and do it. So a little bit of fluoride toothpaste is teeny tiny amount. So dab or smear, no bigger than the size of a grain of rice. And so it's just going to bubble up a little bit. And then if they swallow it, that's fine. We just don't want them to grab the tube of toothpaste and like eat the whole thing. Like that's not what we want. But if it's just a teeny little bit, once or twice a day, a couple times a day, morning, night would be best, and try to get that strength going from the get-go, try to keep cavities away.
You spoke of using a toothbrush when we start to see those little bulges. Is the experience of growing teeth pretty painful for our babies?
Yeah, it seems like for babies, it can be. Each kid's a little different, but they can be cranky. They can put stuff in their mouth. They can start gnawing on things, drooling. They're just more fussy. They're struggling to sleep at night. Like, it's all these things, and while there could be other things that could be leading to some of those things, a lot of times it's pretty consistent with teething. And so a lot of times the parents come in, oh man, my kid's like super cranky. And, oh yeah, here's a new tooth coming in. Like, oh, that explains it. So the kids like to gnaw on stuff. So even if they want to just gnaw on the toothbrush, it can be a little soothing, or something else to just like a teething toy or something. You can even get some that have a little water in it, put in your fridge, and the cooling of it is a little soothing too, so they can just gnaw on it as they're cutting that tooth.
I love that you spoke about routines and the bedtime routine and making sure teeth brushing is in there. When we have a busy day, we pare down the bedtime routine, but there's always teeth. We let our kids know, okay, teeth in bed, that's what we're planning on tonight. And I love that they will remind you too if you forget a step.
So we have some questions about lip ties and tongue ties.
Perfect.
If you have a small infant that is not breastfeeding well, do they come straight to you? Are they usually referred by a pediatrician? How do you help us when our child's latch isn't very good and they need to be evaluated for tongue tie or lip tie?
Yeah, I'd love for him to come straight to me, to a pediatric dentist. A lot of times the pediatricians don't look at the lip, they'll look at the tongue. And if they think it's an issue, they'll clip it, like in the hospital or in their office. But a lot of times they don't look at the lip. And sometimes if the tongue tie is too thick or too far back and it's harder for them to get to, they don't deal with it. So sometimes you go to the lactation specialist, and they're a great resource. And sometimes they can look and try to see, okay, is it the positioning? Is it like, how can they help you with some tips and tricks? But then there might be a lip tie or tongue tie that's making it so the kid actually can't latch great. For the podcast listeners, I'm going to show you some of my hands, but you can't see this. So basically, let's pretend like this is mom or the bottle, like my fist. You got to get the lip up and over and the tongue down and under, and in order to get a nice deep latch. So if the upper lip, if you lift it up, you can see like a little attachment from the lips to the gums, right? Everyone's got it, but some people's it goes farther down, goes all the way to like the ridge of your gums, or it's really thick and wide, and then their lips are pulled back all the time. And so sometimes you can't really see their gums because the lips are always covering it. They might get a little blister right down the middle of their lips, and because they're just rubbing on it all the time. So sometimes I can like see a baby across the room and say, oh, yep, they're lip tied. I can see that little blister on there. The tongue, you look under as they like, lift up their tongue and see if there's an attachment from the tongue to the floor of the mouth. Sometimes it's easier when it's closer to the tip of the tongue to see it. Sometimes it's farther back. And it just depends on how far they can move it around. Does your baby stick out their tongue at you or like make little like noises with it, or does it never come out of their mouth? If it never comes out, you've never seen them stick out their tongue, maybe they're tongue tied. So, but if you have a question, if you're really struggling, it seems like as you're trying to get the baby into a good position to latch, and they're curling that upper lip under, and it's like turning a little whitish, and they're dribbling, they're gulping air, getting gassy, they're making click, click, click noises. All of those are indications that maybe the tongue's in the wrong spot, or the lip's in the wrong spot, or as they're trying to grab on, they're biting more and flattening the nipple as they're just trying to hold on before they like fall off. And so if it's hurting you way too much, if the baby's frustrated, you're frustrated, like come see me or a pediatric dentist. And we'd love to at least do a consultation and see maybe there's something going on. Maybe there's something we could help you out with.
And do you start off with some stretches or some exercising, kind of like taking that finger, touching their tongue so they can learn how to extend the tongue? Or do you immediately like check for that tongue tie and then do a surgical
revision? Yeah, so basically I take a look, and if it's something that needs to be taken care of, and that's all based off of function. So if a baby is tongue-tied or lip-tied, but they're growing great, they're eating great, they're happy, mom's happy, then we leave it. It's not an issue. And then later on, if there's an issue with speech or growth or something like that, we can take care of it. But if there's some failure to thrive, they're just not gaining weight again, mom's frustrated, she's hurting, the baby's colicky, like there's something, and if we see the tongue tie and lip tie and it's pretty thick or really prominent, we can see there's no motion of the tongue or the lip as they're trying to get a good latch, then that's the time to take care of it. So we can just take care of it really quick. It only takes a few minutes, and we can do that surgical intervention right there. We don't sedate for it. We just take care of it right there in the office, and then the moms can immediately try to nurse again right after, and usually they can see a difference like immediately after, because the baby's like, oh, I can finally do it. Some babies still need some help along the way. You might still need to go to a lactation specialist in order to really get that help and tips and tricks for positioning and other things like that. But if anatomically and we can make it so that they can do it, then it sets you up for success.
We came to you with my third baby for a tongue tie correction, and the hardest part for me was the stretches afterwards to make sure it doesn't grow back, because our bodies are resilient and they just want to take it back to where we were. And so that was important to remember, is the stretches after.
Like you said, the body, especially for babies, like kids are awesome. They bounce back, they recover super good. So anytime you get a cut on your skin, your body wants to put it back the way it was. Same thing with this. If I am able to correct the lip tie or tongue tie, the body's like, no, I want to put it back the way it was. And we don't want it to, because then it's going to cause problems again. We show you some stretching of the lip, trying to swipe your finger under the tongue in order to really try to move it around and keep that mobility. And the stretches help it heal in the right spot so that you have that freedom of motion in the future. And so then for the tongue, helping with speech down the road, other things.
Yeah, there's been a lot of research. I've heard of a friend who, she's an adult, and she got her tongue tie corrected because it was contributing to shoulder pain and other things. So it's interesting, all of the things that happen from just a small part.
Yeah, we're finding out that it could lead to sleep apnea and other things. If your tongue isn't able to move forward, then it falls back in the back of your throat, and it makes it harder to breathe at night and can lead to health issues. So there's lots of other reasons to do it. And one of the best things about doing it on the newborn, and I've done it as soon as a day or two old, mom's like, oh, I know this is what needs to happen, come right in, and we do it, and they're super happy that they don't have to like battle through it for a little while. They can just hit it head on. The babies forgive and forget really fast. They're not going to remember. They're going to heal up super great and super fast, instead of when they're older and then they're trying to learn how to speak, and you're trying to correct the tongue tie on a kid who they know what's going on.
Mm-hmm. Yeah. Are there specific places people can go for a list of pediatric dentists in their area, or what would you recommend if someone needs to find a pediatric dentist?
Yeah, I bet you could Google it.
Okay.
And just look for a pediatric dentist in your area. So pediatric dentists are wonderful. They're super fun. They have the additional training, but also the expertise, the child size x-rays or mouth stuff or everything. Yeah, chair. I even have like a chair that fits a 2-year-old. And the kid's like, oh, this fits me. This is great. We have murals on the wall. We have a Peter Pan theme, and it's super fun. Like a pirate ship for the kids to play on. They get toys, movies on the ceiling. So really we're trying to have it be a fun experience, and so that the kids aren't scared of going to the dentist. I'd love to raise a generation of kids that think it's great going to the dentist. And so far we're doing great. And we also have the patience for it. You know, we all know dentistry isn't the funnest thing in the world, but if we can make it a better experience and make it fun, and we have that patience for them. Like some dentists just don't want to deal with kids, but we're built for kids. Like, I don't want to see adults anymore. I just want to see the kids. It's like, for the guys, I don't want to sift through your beard whiskers or other stuff, or get too much makeup on me and other stuff, but it's in front of the women. But the kids are so fun, and we love laughing with them all day, and it keeps me young. I feel like a little kid with them. The little 4-year-old girls coming in, it's all unicorns and sparkles and, you know, princesses and everything. It's like, it's really fun and magical, and we just have a good time. So the pediatric dentists, look them up. look at the Google reviews, and try to find one that ideally says on their website, says they're board certified. Because that means they've not just done the additional training, but they've done additional testing as well over and beyond what's required in order to really give your kids the best experience with the best science behind it.
I love that point, to instill that culture that the dentist is fun. And it starts with us as parents too, to model, oh, we're going to the dentist, and not projecting maybe our past trauma onto the children.
Absolutely. There's so many moms that have had poor experiences, whether as a kid or as a parent, and they're just a little hesitant, a little anxious to go. And so yeah, just do your best, like you said, to just try to be excited. Even if you're like really not inside, just really try to say, okay, we're going to the dentist. And even if in your mind you're like, man, these kids are crazy, like they love going to the dentist, it's okay. Like let's try to make it fun and great. And even if at first they're really little and they're not sure what's going on, usually when they leave and they get a prize, they're excited to come back and like, hey mom, when can we go back to the dentist? This is great.
We can definitely tell that you have a passion for children, for dentistry. So thank you so much for sharing with us today. Do you have any resources that you would recommend, either books or other experts, anything that we can share with our audience?
So you can look up the guidelines for whether it's the American Dental Association or American Academy of Pediatric Dentistry, or even the American Academy of Pediatrics. If you Google things like the guidelines on pregnancy or guidelines on fluoride, or you can look up when the teeth are going to come in and find little tooth charts online or things like that. There's so many resources online, and all of those guidelines are easily available. And those are the things that we base our recommendations on. So you can go ahead and get a heads up on, is it something with the pregnancy? Is it something with the baby? Or when to bring them in or things like that? You can start looking them up. And then always give us a call. We're here for you. We want to be on your team. We want to help you out. We want to support you. And you just don't know what you don't know. And we're the experts. We can help you and guide you with your kids, with your littles, and just try to make it the best experience we can.
My pediatrician had a list of pediatric dentists. That's how I found you. And she also had ones that were covered by Medicaid, ones that weren't. And so just knowing your resources, knowing your support community. Jordan has our Mom Squad secret of the week. She says, during a contraction, mentally scan your body for where you are holding extra tension and relax it. And I think this relates to dentistry too. I feel like when I go to the dentist, I'm tensing up and I'm, holding tension there. So yeah, just relaxing, making it a positive experience, and trying to visualize it before even going in.
We're so happy that we were able to talk to you today. Oftentimes you go to the dentist and you're not able to talk to your dentist. So it was a wonderful conversation. Thank you for being on the podcast.
Thank you for having me. It's wonderful you guys are doing this and really empowering moms and really giving them resources to help them be as successful as they can.
Thank you. Thanks for joining us on today's episode. We hope you've been elevated and inspired by this week's expert.
Subscribe today so you never miss an episode. And please share our podcast or post on your social media so that other moms and dads-to-be can also have the best birth.
Please note that the information provided is based on the expert's insights and personal experience. It is not intended as medical guidance. Please seek the advice of your medical provider as it applies to your specific condition.